Hi, Dr. Christopher Jonkis here. I want to talk a bit today about depression. I get a lot of questions about depression, anxiety, and stress, and it's important to discuss this and give people a sense of what to watch for. So everyone is stressed right now. There's a lot going on. We all are fearful of what will come. There's a lot of social distancing. People have lost their normal connections to others that they rely on. And that's common, and everyone feels some element of stress right now. It would be unusual not to. But major depression is another issue. That's something that's more severe than probably what most of us are feeling. And it's something that is probably going to be more common now, and I'm seeing more of this. And it's more common because of the things that I mentioned. So what is it exactly? This is a severely depressed mood. With this, patients lose the ability to enjoy any of the normally enjoyable activities in life. They may have they may feel very sluggish. They may not feel like doing anything. They may want to stay in bed all day. They may feel helpless or hopeless. Sometimes there's suicidal thought. Sometimes people actually, when they are depressed to this level, develop a psychosis, meaning they may hear and see things that other people don't hear or see. It's important that if you have any of these severe depressive symptoms that you reach out to your healthcare provider. We can help you, particularly if you're feeling like you wish to harm yourself or others. That's particularly important. Please reach out. We can help you. Don't let it get to that point. Now, for the rest of us who may not have symptoms to that severity, it's also important to reach out to your provider, your healthcare provider, if you feel you need help in any way. We, once again, can help you to get through this time. There are things that you can do that will reduce the anxiety and the stress that you may be experiencing, and I want to talk a little bit about that. It's important to have a schedule. When we were all working, and many of us aren't working now in the way that we worked before, we had a routine, a schedule, and that gives us a sense of comfort. It's important to have a schedule still, even if you're at home and not at work. You have to have a schedule. You have to get up every day with a purpose. It's important to take care of your body. You want to eat healthy. You don't want to drink too much alcohol. You want to make sure you're exercising. These are all crucial things. And with social distancing, people can feel very unconnected. It's important that you make an effort to connect to people. And this can be done virtually. Tonight I have a virtual meeting with a group that I'm friendly with, and over the weekend another one. It takes some time to set things up. You can use Zoom platforms. There's a lot of technology platforms that can be used, FaceTime, etc. But it's really crucial and important to do this. The loss of connection to people can be very difficult to deal with, and can increase the rate of anxiety and depression. And once again, if you have any questions, feel free to reach out to your healthcare provider. So lastly, I just want to thank all of the people out there that are working to help people get through this crisis. All of my fellow healthcare providers, especially those that are working in the hospitals and the emergency rooms, especially those that are working in long-term care facilities with our frail elderly. This is really the epicenter of where we're seeing a lot of illness. I want to also thank everyone who is out there keeping our society going. The postmen, the firemen, the policemen, people doing construction, whatever it may be, people working in supermarkets or in stores so that we can get the goods that we need. Of course, our 911 operators, and of course all of our first responders, paramedics, etc. So thank you to everyone. And to everyone who does not have that role, I want you to understand that you can still be a hero in all of this. Just by maintaining good hand hygiene and really good social distancing, you will save lives. You may not know whose life you've saved, but you will, and you will be a hero. So it's crucial that we all do that. We all have to take part in resolving this issue. And by doing those things that I mentioned, you can be a hero too and save others' lives. Thank you. That's all for today, and I'll talk to you again over the next couple of days.